Hello, I'm Dr. Brent Gibson, and I'm excited today because I'm going to actually talk to you a little bit about some additional information about how you can manage the causes of nerve damage. So basically, as you remember, there's some distinct steps to manage peripheral neuropathy. Number one, you need to understand peripheral neuropathy and ultimately understand your peripheral neuropathy. Number two, you manage the symptoms of peripheral neuropathy so that you can actually function normally. Number three, you control the nerve damage. Now, the keys to controlling nerve damage is going through some simple steps. One, you need to identify the causes of the nerve damage. And then number two, you need to manage those causes. So what I want to talk to you today about is how to manage those causes. And there's really four ways you can do this. Number one, you can eliminate the cause. If you have, say, a nerve damage from a toxicity, whether it's alcohol or a medication or any other type of toxic type injury, the best way to manage this type of nerve damage is to eliminate the cause. A detox or getting off medications or stopping your alcohol or drug use can actually make a big difference in stopping the nerve damage. That's a key. That's an important part to this treatment. Number two is reverse the damage. Now, there are multiple different reasons why you may have to reverse the damage instead of just eliminate the damage. If the damage has already been done, then your process is you need to go through and actually reverse it and work on working backwards. One of the common things that you can reverse the damage, say, is with a cancer treatment type cause peripheral neuropathy. You have to work on reversing the damage by improving the function of the nerves through the way that you eat, through the nutrients you're taking in, and even exercise. If you've got damage to the neuron, the nerve cell, and you've got mitochondria that are decreased or dead inside the cell, so you don't have any mitochondria or the energy portion of the cell that you need, exercise improves and increases significantly the mitochondria in the cell. So it can actually be very, very valuable. Number three is to treat the problem. So the easiest one to talk about there's actually two actually that we'll use. One is thyroid disease. They found that if you have a thyroid problem and you treat the thyroid problem, the peripheral neuropathy goes away because you're treating the problem. Same thing with diabetes. If you manage your diabetes aggressively, you can stop the nerve damage that's happening from the high blood sugars, but it has to be very aggressive. A lot of times people are being told with their diabetes to keep their blood sugar, their hemoglobin A1C below 7. The truth is you want it around 5. If you have it around 5, then the chances of you having a peripheral neuropathy damage or peripheral neuropathy problem is significantly decreased. And the fourth, of course, is repair. So in some cases, the best way to treat or control the nerve damage is to repair it and move it backwards completely. So instead of just eliminating the cause, reversing the damage, treating the damage, we can work on repairing the damage. And most of the time, in most ways that we're managing peripheral neuropathy, I always like to do repair, but a lot of times you can do some of these others in the interim and then work on repair because repair takes a longer period of time. This is Dr. Brent Gibson, and this is your Neuropathy Nugget, day 277. Then this is part of controlling peripheral nerve damage by managing the cause through elimination, reverse, treat, or repair. It's Dr. Brent Gibson. Have a great